So let's begin with the terminology. What is failure to launch? It's described as the situation of adult children living at home and highly dependent on their parents. In our experience, that is in the experience of the Personality Disorders Institute, the children do not have to be living at home, but they remain dependent on their parents and are unable to establish their own lives. It is not an official diagnosis, and it can be applied to a range of functioning. It is not a monolithic unitary phenomenon. It can be related to a number of factors. Sometimes it's related to factors in the society. Sometimes it's related to family factors. And sometimes it's related to psychiatric and psychological problems, although, of course, those three different dimensions can intertwine, can have an impact on each other. But it's important to assess what the main level of the problem is and what the principal factors are in order to choose the most appropriate treatment approach. Now, in terms of societal factors, we have to be practical and concrete. If the society in which a person is living has a very bad economy, it might be difficult for somebody to find productive employment or work to engage in. But we don't put too much emphasis on that factor, because one of the things we like to think about is, if I were in the position of this person, what would I do? So if any of us, I'm speaking without knowing, but I'm making some assumptions. If any of us were in a situation where it was a very bad economy and hard to find work, we probably keep trying. But I don't mean to be unsympathetic. I do know there are societies that for various reasons have very high unemployment rates, so that can be part of the problem. Now, beyond that very external factor, when we begin to get to psychological elements, the sense of pressure that a person is living with can inhibit their application of their energy and talent into a practical endeavor. And sometimes the pressure is external. Sometimes parents are extremely demanding and not accepting of anything but very high level performance. Related to that, but sometimes more of an independent issue, is the internal pressure, which is very related to what we talked about when we talked about narcissism, that need to be the ideal, the inability to accept any level of functioning that does not correspond to the ideal. But increasingly, in addition to these societal and psychological factors, there's the introduction of social media. This is something that has developed so quickly in society. We have not been able to keep up with it in terms of adequate research, but more and more is understood and is learned about that. And it seems, from what we know, that social media, I'm talking about things like TikTok, Instagram, there are many other things, Facebook. These can have a very damaging effect on young people as they develop. Why? Because of the impact of unrealistic, idealized images, and because of the lack of direct contact with others. I contrast this to the experience of young people growing up during the vast stretches of human history before, well, I would say before television, because once television became prominent, the focus of many children's early years shifted from the playground where they would have to entertain themselves, amuse themselves, find interesting activities to do, shifted from that more active kind of involvement with others to a passive recipient of stimulation, watching images on the screen. So we have the double problem of seeing idealized images to which these unfortunate young people feel they should adhere. And along with the overexposure to idealized, unrealistic images is the decrease in direct contact with others. You've all, I'm sure, seen young people who live looking at their phone and don't have as much of a physical, concrete contact with others. I'm not saying their experience is devoid of that, but there's a shift toward the screen. Now, there's something about the mind that is relevant here, and I don't want to put all the blame on the development of technology, because if you know Flaubert's great novel, Madame Bovary, it is an example of relatively relatively severe, not the most severe, but it's an example of a person with a narcissistic personality disorder. And as you know, if you're familiar with the work, the main character ends her life by suicide. Now, one of the interesting little details about the novel Madame Bovary is that in the early pages, in a description that many people just pass over, the author says that Emma Bovary's father was very pessimistic about her future because she preoccupied her time reading romantic novels. So you don't need electronics to get caught up in a world of idealized images that do not correspond to reality. And in the mid-19th century, the problem, according to Flaubert, was idealized images in books. So there's something about the mind seeking idealized images that creates problems for real development. Now, along with the economy, the demands, internal or external, to perform, and the ideal images from social media, there can be family factors, helicopter parents, if you know the term, parents who are always watching over what the children are doing, don't provide enough freedom for the children to develop on their own. It used to be in this country that the child would graduate from high school and go to university where they generally lived on their own, and then they might have a weekly phone call with the parents. Now, often the parents are checking every day or multiple times a day to see how they're doing. And another problem is what we call accommodation to maladaptive behaviors. What do I mean by that? I have to preface what I'm going to say to you by stating my concern that I might at this point sound like a very conservative and unempathic person, because I do realize that some people have disabilities or weaknesses that should be taken into account. But there's been a trend here in this country for people to say increasingly, I have this problem, ADHD, for example. So since I have this problem, I should be given special consideration. I should be given more time to take my examinations, is the classic example. So even though there's room for the appropriate application of those special accommodations, increasingly those accommodations are given when they are not objectively needed. And this creates a situation where people expect special treatment, expect not to have to function by the objective standards. And you can see how that overlaps with a characteristic of narcissism, the entitlement and the expectation of special treatment. So when we look more closely at the psychological factors involved in failure to launch, anxiety is clearly a part of it. In fact, at one of the main hospitals here, they have a clinic for failure to launch young adults, and their treatment is totally oriented around treating anxiety. They feel that if you can help the young person be less anxious, that will free them up to function. And that may be true in some cases. Another frequent problem is attention deficit disorder or attention deficit hyperactivity disorder. And there again, that might be a relatively circumscribed condition that can be treated on its own. And if it's treated successfully, perhaps the block in development will resolve and the person will go back to a successful developmental pathway. But in our experience, again, I'm talking about the personality disorders, the large majority of people we see with failure to launch syndrome seem to have an underlying narcissistic personality disorder. That's anticipating what I say at the end of this slide, because if the problem is anxiety or ADHD, these problems can be addressed symptomatically. But like most conditions that affect the person's ability to engage successfully in life, the root of the problem is generally more than one specific symptom. And to repeat what I said, maybe it's because we tend to get referred the most difficult cases, but our modal experience, our typical experience is to find an underlying narcissistic personality disorder. However, in our patients, there is the very frequent experience that the individual will invoke a particular symptom to rationalize their inability to function in the world. I can't function because of anxiety. I can't function because of ADHD. I can't function because of my allergies. The young man, not that young man, the man who was about 30 years old, who I described yesterday, the one who at the end of the treatment told me he didn't care at all about his parents, he just wanted to exploit them. He tried to invoke his allergies as the valid, in his mind, reason that he couldn't succeed in his studies or apply himself consistently at a job. And very unfortunately, his parents were willing to consider that as a reasonable explanation, which from my perspective was not reasonable at all. As you can hear from what I'm saying, and here again, I have a little bit of a concern of sounding like a mean conservative person. People with failure to launch may invoke a victim status, and I will give you an example of that shortly. And they blame they blame their lack of involvement in life. They blame their lack of advance in life on someone else and see the responsibility as outside of themselves.